Hi, I'm Dr. Heather Rice from Wellspring Chiropractic Lifestyle Center. Today we're talking about migraines, and I found it's useful to actually look at the history of that word. It gives us some insight into what might be causing the migraines. The word comes from hemicrania from the Greek, and that refers to half of the cranium or half of the head. And that's because migraines are typically going to be a pulsating pain involving one side of the head, and it oftentimes can involve vomiting and nausea. It can have an auditory or a visual disturbance with it, an aura. It can last from anywhere from 4 hours to a few days, and it's where people just want to lock themselves in a room and stop all the sensory input. So it's also interesting that historically they've been described as nerve storms that originate from the base of the brain. I find that so fascinating because when we look at where I often find patterns in the nervous system that are associated with migraines, it is in that upper cervical area where the brainstem lives. So the brain sends the messages down into the brainstem, into the top of the neck, and then that continues down into the spinal cord, going right down the spine. We literally have found descriptions of migraines from 7,000 years ago in the Egyptian historical documents, and even 1,500 years ago on a certain papyrus, they were exactly describing a migraine. So it's been around for a while. This idea of calling them sick headaches, it's because of the nausea and vomiting that often comes along with it. Well, we oftentimes find that people that have suffering from migraines, they have had in their history whiplash or concussions or other types of jarring and trauma to the spine. And so when that happens, that can misalign the vertebrae in the top of the neck, and that's where the nerves come out that go right up into the head. It's also where you can have the nerves that affect balance and vertigo, that sort of thing, and that can be one of the factors with the nausea. So when they talk about this nerve storm happening, that can be happening right in the brainstem. That's right in the top of the neck. Now, I often find clinically that hormonal derangement can be part of this picture as well. And so when we look at the spine, oftentimes adjustments in the top of the neck, but also in the middle of the back and the lumbar spine can seem to help people that struggle with migraines. Well, why would that be? That's because when we look at the nerves that control the hormones in the body, those are where those nerves exit from the spine to go to those organs and glands that are in charge of hormonal function. So we do know that the very top of the brain, or the top of the neck that comes up into the brain and the cranium, that the cranial bones, including the sphenoid bone, the pituitary gland sits right in the middle of the sphenoid bone. And so when the pituitary is affected, that is the master gland that controls all of the other hormonal glands in the body. So that can be a factor. We also know that the thyroid can be involved, and the nerves that control the thyroid come right out of the neck. And there's a whole hormonal cascade that occurs from the pituitary through the thyroid to the adrenal glands, right down into the reproductive organs and the ovaries that control those reproductive hormones. So we do find that the nerves that come out of the lumbar spine, they are in charge of running the ovaries. The nerves that come out of the middle of the back are in charge of running the adrenal glands. So that's how those adjustments can actually help people that struggle with migraines. Now, I also have noticed that we know that stress is one of the factors also involved with migraines, and I've noticed that there's been an increase in migraine incidence here in the practice in the last couple of years. Again, that can be really related to the stresses just from managing the whole pandemic. So this whole COVID catastrophe that has occurred, where it's affected our lives in so many ways with isolation, increased anxiety, and stress. And so that again can affect hormone levels, and that can then have a factor that's related to migraines. So I hope that you found this useful. Certainly understanding the background behind migraines helps us lead us to what the cause is. And if you're curious of whether or not we can help you, just click on the link and we can set up a consultation and we can find out exactly what's causing your migraines and whether or not we can help.